Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Last week, we talked about the different anatomical defects that causes infertility in women. Today, we're going to talk about the anatomical deficiencies in men that may cause infertility. So we'll go right into it. So, number one is erectile dysfunction, right? That's usually due to poor vascular health. Smoking, diabetes, obesity, right? Certain medications. If you have poor vasculature or poor circulation, it certainly will cause erectile dysfunction. Things like psychological stress, emotional stress, right? Those will also impact erectile dysfunction. So basically, erectile dysfunction is a big factor in terms of male anatomy. The other one is called retrograde ejaculation, where when the male ejaculates, the semen does not ejaculate out through the penis, but actually ejaculates into the bladder. So there's no sperm coming out. So that's in a case where sometimes you've had surgery in the past, or some sort of issue, you had some surgical intervention, or it could just be due to an anatomical deficiency. So retrograde ejaculation is very common, more common than people think. The other one is ejaculatory duct blockage. Basically, there's a duct and the sperm can't get out, right? It's basically shooting blanks, and you're not getting pregnant because the duct is blocked. The other one called is varicocele. This is an issue with the veins and the valves of the veins through the testes. Now, the sperm is produced within the testes, and if you don't have proper temperature regulation in the testes, you cannot produce sperm, right? So if it's too hot, too cold, right? Usually with varicocele, the temperature is too warm, and you cannot produce healthy sperm in those temperatures. So you'll have issues with varicoceles because of poor temperature regulation. Another one is a birth defect called Hypospadias. Now, this is a deficiency that occurs because of a defect. So instead of having the opening at the tip of the penis, it actually has it underneath. And this is where it's not just getting to where it needs to get to because of the placement. So this is a birth defect, not any type of, psychological issue or anything like that. But in terms of anatomy, though, male causes are just as significant as female causes. So when we talk about infertility, you have to understand that there is a female component, but certainly there is also a male component. And both partners, right, if they're trying to get pregnant, need to be on the same page. They're both willing to go through the process of figuring out what the mechanism is. Because if you just work on the female and do all these extraordinary things and never get pregnant, it could be the male. So you both have to be on it and be diligent and trying to figure out what the needs are. So when we talk about, let's say, erectile dysfunction, and you have obesity, diabetes, a smoker, right? Severe psychological stress, and those types of things. Those things need to be managed in order to be corrected. So it's very important to look at the underlying mechanisms rather than just look for a cause in the female side. We're going to continue on the journey of infertility. Last week, we talked about different components of healthy tissues and cells that are requirements for a healthy pregnancy. Today, we're going to talk about follicular health and the eggs of the female, right? So let's go over some facts. Here at conception, the female is born with 1 to 2 million eggs. You have a definitive number. It's not, you can't go ahead and produce more eggs throughout your lifetime. You just have a certain number of eggs. As we go through, by the age of 35, only 6% of the remaining eggs are considered healthy, right? These are statistical numbers. So what happens is you have a decrease in egg quality at the age of 35, and you also have a decrease in egg quantity So the quality and quantity of the eggs starts to diminish significantly by the age of 35. So what does that mean? The ovulatory maturation, right? When you have the eggs starting to mature, you're going to have more errors or abnormal DNA of the eggs. So you're more susceptible for birth defects and genetic disorders, right? So errors and abnormal DNA. So it's more difficult to get pregnant at the age of 35 and older. So if that occurs, what is the optimal ages, right? So at age 20, 20% of your eggs are considered abnormal. By the age of 40, 80% are considered abnormal. So statistically, the chances of getting pregnant at the age of 35 starts to diminish significantly. So the ideal pregnancy time is probably from your 20s up to maybe the late 20s, 30s. After that, you're getting a significant decline in the number of eggs, the quality of the eggs, and then you're going to have more DNA errors right here. And so you have to be able to have a window where you want to get pregnant. So follicular health is very important. Now, how do we know maybe the follicular health might not be healthy? One, you have to look at, is my menstruation normal? Is it on a normal cycle month to month? Or is it short, or is it long, or is it absent? Those things all matter, because if you're not menstruating at a normal rate or a consistent cycle, then the ovulatory or the follicles may not be quite healthy. So when we look at this, we have one common factor that seems to affect the health of the eggs. And that factor is inflammation. So what would cause inflammation? Inflammation could be anywhere from food sensitivities, infection or viruses, or poor lifestyle such as smoking and other things. So understanding where the inflammation is coming from, or even checking for inflammation in a female who wants to get pregnant, is important, because it affects the health of the eggs. So inflammation, or subtle inflammation, or even low-grade inflammation, will certainly affect that. So overall, you want to be pregnant probably between the age of 20 to maybe 29. After that, it just gets a little bit more difficult. By the age of 35, it gets very difficult. And by the age of 40, 80% of what you have in terms of the egg is going to be abnormal. So it's very important you have a window to get pregnant. So it's very important to find the right window and the right health of the egg. We've been talking about infertility, and on our last video we talked about the female aspect in terms of the quantity and quality of the eggs. Today we're going to talk about the male aspect of infertility, and how do we go ahead and analyze if there's issues with the male in terms of the infertility process, right? So when we look at this, clinical evaluation of the male infertility patient, right? First, you got to do a semen analysis. In the semen analysis, what do we look for? We're looking for abnormal sperm morphology. Basically, does it look like a normal sperm that can swim and move around normally, right? And then you look at leukocyte concentration. Leukocyte basically means white blood cell. Is there white blood cells or leukocytes within the sperm content, right? If there is, it could indicate, one, the patient might actually have an infection or an inflammatory process going on, which is creating white blood cells in the semen concentration, okay? Low sperm count is a factor. Abnormal sperm motility. Can the sperm move at a normal rate to get to where it needs to get to? Basically, that's what it means, right? They can do this test in a regular LabCorp request. Bacterial concentration. Is there bacteria floating around in there, which can also indicate infection? So it's important to understand there's testing available, which is really simple to do, right? And to look at the quality or the strength of the sperm to get to where it needs to get to. Is there an infection, right? So it's important to understand those types of things. After the sperm analysis or semen analysis, you can do things like ultrasound, MRI. You can also look for sperm antibodies. Is the patient making antibodies to their own sperm or semen, right? Serum chromosomal testing to see if there's genetic variants. Much like in women, you can also do genetic testing. And then vascular studies. Poor blood flow, things like diabetes, right? Anemias, things that prevent blood flow to get to where it needs to get to is problematic in the production of sperm. So you can do vascular studies, serum chromosomal testing, sperm antibodies, ultrasound MRIs, and then a semen analysis to look at motility, bacteria, white blood cells, etc. So it's important to analyze not just the female component of infertility, but also the male component of infertility, okay? So it's important to understand this, and there are simple tests that you can do to start out with. Today, we're going to continue on the journey of infertility. And behind me, we're going to talk about the common causes of ovulatory dysfunction or disorders, or not even having menstruation, right? So menstrual irregularities or not having any menstruation at all. So what are some of the common causes? So there's a condition called PCOS, or polycystic ovarian syndrome. Now this is pretty common in women and usually starts with irregular menstruation, elevation of testosterone, and sometimes issues with blood sugar dysregulation or insulin resistance or diabetes. So PCOS will basically alter hormonal regulation. Therefore, it's difficult for the female to ovulate normally and affects estrogen because elevation of testosterone will impact that. The other one is low weight. So being too thin for a woman to become pregnant becomes difficult for them because the body fat structure, right? You need a certain amount of body fat in order to get pregnant. So if you're really thin, it becomes a problem. Extreme exercise. So someone who is like a triathlete, someone who goes and runs marathons, they tend to lose their menstruation, or their menstruation becomes very irregular. And therefore, extreme exercise puts a lot of oxidative stress on their body, which can impact pregnancy. Extreme stress. It cannot be understated that stress has a huge factor on many aspects of health. And extreme stress elevates cortisol, and cortisol impacts hormonal pathways. So there's this feedback mechanism where the hypothalamus, a part of the brain, talks to the pituitary to adrenal glands. If the adrenal glands are overproducing cortisol, it reverts back and has a loop to the brain, which will affect the hypothalamic pituitary ovarian axis. So hormonal dysregulation can occur due to high stress. Hyperprolactinemia. This is where you're increasing the production of prolactin, which is basically a hormone that increases breast milk production. So prolactinemia usually could be a small tumor in the pituitary gland, which will increase that. But there's other things that can impact it, such as oxidative stress, chemical stress, and so forth. Thyroid dysfunction, both hyperthyroid and hypothyroid. Now, I've spoken a lot about hypothyroid in the past and Hashimoto's disease. I want you to go back and watch some of those videos because it's very important to understand that hormonal dysregulation is not just about estrogen and progesterone, but thyroid hormone. So thyroid hormone, or even the autoimmune version, which is the Hashimoto's thyroiditis, can significantly impact pregnancy or infertility. Perimenopause. So when women try to get pregnant and they've got they got married, let's say at the age of 39. After the age of 35, you're losing your egg reserves, right? The viability of your eggs goes down significantly. After the age of 40, it goes down even further. So if you start to reach that age of perimenopause and expect to get pregnant, it becomes very difficult. So in this game of getting pregnant, the earlier the better, really, right? Because you have all the reserves, you're healthy, and so forth. When you get into that 35 and up, 40 and up, it becomes much more difficult. Premature ovarian failure. Now, this can be kind of a chromosomal issue, but chemical impacts, oxidative stress, all these things can impact ovarian failure. Chemotherapy, medications, and so forth can also impact egg health and failure of the ovarian reserves. So it's very important to understand, can we modulate some of this stuff, right? If we're really low weight, we got to figure out why, or are we eating enough? If you're doing extreme exercise, trying to get pregnant, and you're having difficulty, then obviously that can be modulated also. If you look at thyroid dysfunction, it's very important to check all the thyroid hormones, including TSH, T4, T3, free T4, T3, and the thyroid antibodies like TPO and TGB antibodies, right? So it's very important to do these types of things. But overall, these are the most common type of ovarian dysfunction causes. So it's very important to understand and then manage these types of conditions so you can get pregnant. We've been talking about infertility over the last several weeks. Today we're going to talk about what causes the quality and quantity of eggs to deteriorate. So we're going to go over a list of different things that may impact the quantity and quality of the eggs. So we're going to look at senescence. Basically, natural aging, decreased quantity and quality of the eggs. After the age of 35, you're going to note that there's going to be more chromosomal defects and the availability of healthy eggs in the female, right? And then you have endocrine imbalance. Hypothyroid is one of those things that need to be checked with every patient who has difficulty getting pregnant. So hypothyroid, or low functioning thyroid, is an indication that your thyroid gland is not producing enough hormones, or you may have an autoimmune disease called Hashimoto's thyroiditis, which impacts the thyroid. So I have a whole list of other videos. You can go back and watch specific ones about hypothyroid and Hashimoto's. So I suggest and go back and look at the list of different thyroid videos that we've made in the past. But in essence, hypothyroid will decrease follicle stimulating hormone, or FSH, increases androgens, and then increases prolactins. So hormonal disruption in terms of menstruation, or irregular menstruation, or shortened duration or long duration of menstruation can all impact the quality of the eggs. Oxidative stress. This is a big one, and people really don't think about this. But air pollution in itself, environmental toxins, right, fumes, gases, etc., cigarette smoke, any type of illicit drug will also impact that. And then radioactive exposure, X-rays, CT scans, dyes, etc., can impact the health of the eggs. Another one is medications, right? Most cancer medications will obviously impact that. And it's kind of a necessary evil for some patients, right? If you have cancer, what are your options? And then you have these medications that treat autoimmune disease, immunosuppressants, and so forth, and steroids. So those will all impact the quality and quantity of the eggs. And then obviously you have genetic predisposition, chromosomal defects or abnormalities. And then you have endometriosis. One of the main causes for endometriosis is inflammation, and this tissue will get into certain areas that it shouldn't be, and causes an inflammatory load on that patient. So when we look at quality, quantity of eggs, we're looking at multiple factors. can we narrow things down to see what type of exposure a female patient might have that might be causing infertility. So it's very important to kind of go through the different checklists and figure out what is going wrong with that patient, okay? My name is Dr. Jin Sung. We're at Clinical Excellence Meets Excellent Results, and we'll see you guys next week on the healthy side. Have an awesome day.